Kongres Współpracy Transgranicznej Lublin 2022. Bezpieczeństwo i solidarność. Coroczne spotkanie praktyków współpracy transgranicznej z Unii Europejskiej i Partnerstwa Wschodniego. 3 dni paneli, spotkań i debat liderów samorządowych, organizacji pozarządowych i ekspertów z całej Europy. Forum partnerów. Giełda grantodawców. Wizyty studyjne, warsztaty, koncerty i spektakle. Na żywo i online. Lublin, 5-7 października 2022. Zarejestruj się bezpłatnie na stronie kongres.lublin.eu.
Witam serdecznie ponownie tutaj w Lublinie na wspólnej sali konferencyjnej.
Welcome back to the conference room. Welcome back in Lublin. Those of you who are watching online.
Transgranicznej nigdy o medycynie nie
We
rozmawiamy.
haven't really talked about medicine during our congresses. It's the very first time. And
Że
the
dziś
catchphrase for today is security and solidarity. And I believe there are many people
nie mieliśmy
who
nigdy takiego.
make it into our town through hospitals.
I
That's a very new perspective, a very new experience. Hence this panel, and I will now give the floor to our friend
chciałbym przypomnieć, że w dniu
who will
jutrzejszym
chair it. And just to remind you, tomorrow
w Puławskiej Strefie Ekonomicznej
we have a study visit
do tej
in the economic zone in Puławy. You can join us tomorrow morning. It's a very interesting destination, very interesting venue. I do encourage those of you who would like to go
można
to go. You can talk to the people at the reception desk and sign up for the bus tomorrow.
których nie
And
widzieliśmy.
now perhaps we can give the floor to those who we haven't seen in the streets, at public assemblies, meetings, those who have been supporting
Wchodzą nowych
the needy.
i obywateli Ukrainy.
And I mean both the residents of the local community and refugees from Ukraine, both civilians and the military who need medical assistance. Over
Dzień dobry
to you.
Państwu. Dzisiaj będziemy rozmawiali o
Good
medycynie
morning. The topic of this panel is medicine
i medycyna
without borders.
efekt doświadczeń
And this
naszych
is
ostatnich
not only the
Ale ty-
effect of our last month's experience,
Polskiego
it's the experience of
wspomniał.
our Lublin community and our cooperation spanning many years, although we don't talk about this
Właśnie
very openly too much. But, well, we are given this opportunity today. So we'll talk about international cooperation around medicine and health
jakie trendy wiemy
before the war and what the trends are
przyszłych
now. And of course, we will try to have a look at where we go, what the future may be in the context of new technologies and international cooperation.
przyjęli. Pani
We have the following speakers.
publicznego szpitala
Beata Gawelska, Director of the Independent Public Clinical Hospital No. 1 in
pan dyrektor
Lublin.
Radosław
Radosław, Starownik, Director of the Independent Public Clinical Hospital No. 4 in Lublin.
to nasze największe
So, the heads of 2 largest hospitals in Lublin.
Maslyak, kierownik
Professor Zwenyslawa, Maslyak, Head of the Department of Hematology of the Institute of Blood, Pathology and Transfusion
i
Medicine
rozwoju
of the National Academy of Medical Sciences in Ukraine and President of the Lviv Foundation for the Development of Hematology.
Pani doktor Nataliya Preys,
Dr. Nataliya Preys
regionalny szpital
from the Lviv Regional Clinical Hospital
okulistyki w Lwowie, która dzisiaj rozmawia
and also the head of eye surgery clinic
z nami.
in Lviv, and she's in fact in Chicago now. Good afternoon. Good morning.
Dzień dobry Państwu.
Dzień dobry. Jest z nami również pan
We
profesor
also have with us Professor Marek, who's head of the Department of the Haemato-oncology and Bone Marrow Transplantation Clinic from the Medical University of Lublin.
SK1 oraz profesor
He also works with the Hospital Number 1, and Tomasz Chorągiewicz
Uniwersytetu.
from Child Eye Surgery Department of
Ścisłą współpracę
the Children's Hospital in Lublin. International cooperation in medicine and health
na Ukrainie.
has recently been discussed in the context of the military conflict in Ukraine. This cooperation between our and Ukrainian hospitals started long before the war. I believe Professor Hus and Professor Maslyak will be able to tell us the most. Professor Maslyak, it's a long
Współpraca międzynarodowa.
history of cooperation. When did it start? What it was like in the past? And what significance cooperation with the Lublin Medical University has for you, the university and Lublin hospitals?
Szanowni Państwo, działalność chciałabym powiedzieć trochę o naszym instytucie i o naszej działalności w Lwowie. Ona jest skierowana
Well, this cooperation focuses
komórek
on
i
researching
nowych metod
various diseases, contagious diseases, and blood issues concerning
negatywne,
the cancer of marrow,
і також
very acute diseases,
у нас
including oncological ones. We set this field of research long time ago through our international contacts. We work with the European
ми
network
рамах проблемам цього у пацієнтів
of leukemia research.
взяли львовський
Thanks to our participation in clinical research at international level,
панель інноваційних ліків.
we have been able to register many innovative medicines in Ukraine. Many of them have become routine
Клініка
medicines administered to patients.
навіть Австралії.
Our doctors have taken part in courses and trainings across Europe, and our institute works with the Hematology clinic of the Lublin Medical University. The cooperation started between outstanding hematologists, Professor Mushiński from Lublin and Professor Bolowski from Lviv. They have launched several projects, very ambitious projects,
Центром трансплантації шпік.
just like a Marrow Transplantation project, Polish-Ukrainian project that is running now. Lublin has a very powerful marrow transplantation facility. We are planning to set up one.
Є ще такі були проекти, як спільні польсько-українські конференції.
And we also held a number of conferences, research conferences, chaired by, for example, Professor Hus and Lviv specialists. I think most of them have completed trainings in our partner facility in Lublin. So now Lublin offers a really big help to Ukrainian patients, Lviv-based patients, because of the war and our limited capacity to offer medical services. Thanks to our Polish friends, we can access international journals, including online, and we didn't stop our cooperation even during the COVID pandemic, and we continue to cooperate now during the war. The first phone call I received in the morning on the 24th of February was from Professor Marek from Lublin. He offered his assistance, and it was very moving
Підтримуємо teraz.
And all the time we keep repeating invitations to cooperate, to exchange, or to take part in events like today.
І маємо завдяки нашим польським колегам
So thanks to our Polish colleagues, we have access
усунення гематології
to the latest articles, journals, discoveries in the area of hematology.
програму лічення в Україні. Лічуся в Любліні теж. У професора в клініці професора Марка Хуса, консультував професор
Professor Hus consults our specialists. We also cooperate with Krakow,
професора Скутніцького і зараз
with Professor Skibinski from Krakow's clinic, Professor Tomasz Sacha,
Артур Юрчишин.
Professor Jurczyshin. We also have partners in Warsaw. We can always make a phone call, for example, Professor Jędrzejczyk to ask a question
Являємося в цьому
about various problems that we encounter in the daily work.
польських наших колег
So following recommendations from our Polish colleagues,
25 лет став
I think
душ розвою гематології.
we have worked together for more than 25 years. So following the recommendation, we set up a cooperation facility in hematology in Lviv.
Досить зреалізованих
This facility has completed many good quality projects. Now, looking ahead, let me stress that we want to continue to receive a high quality
которым мы не можем помочь.
and specialist assistance from our Polish colleagues, something we cannot do anymore in Ukraine because we have not enough capacity to do this.
Ограничены. Терапии и пошукование.
And we would like to also have access to donors, access to scientific knowledge, to molecular studies with acute leukemias, because this is something we can't do in Ukraine because it's too expensive, and also various diseases and conditions related to transplantation. So what can we offer in this cooperation? We have relatively good laboratory of molecular genetics. It can join scientific projects. We are also developing a new stage of identification of residual diseases among leukemia patients, but also plasmacytoma patients. And
проведення гашеля-типування з допомогою молекулярно-генетичних бадань і
we are also capable of developing our own register of donors,
польських колегів. І може
of stem cells, perhaps with the assistance of Polish colleagues. We would like to set up a Polish-Ukrainian center that will be able to cooperate, exchange with other donor registers. So this is very briefly about our partnership, about our plans. I'd like to thank for inviting me to this Congress, although this is only online. I hope our cooperation will continue for long. Thank you so much.
Od początku, kiedy zaczęłam tutaj pracować.
Thank you very much, the professor. We've been working with medical experts when the city council took decision in cooperation with you to open up the medical cluster then it was the care for patient and the interest of patients, but also ways to help Ukrainian patients were the main topics of our discussions. So let me ask you for some overview, your perspective of the cooperation that Professor from Lviv talked about. Thank you for invitation to this Congress. It's a unique moment to me, where we can talk about things from the past, but also the future improvements, about future cooperation, common platform to connect us. I'm thinking about Lviv, with which we have more than 20 years of the cooperation, number of projects that we have completed and we will be developing in the future. The creative the activity of my predecessor, Anna Dmoszyńska, was the starting point. She actually felt the need to share something that we had received before from our Western European colleagues. We had the best hematology centers, scholarships in Europe, in the US, where we learned the advanced diagnostic and treatment methods, but we also learned the values for team building in medicine, which, especially in hematology, is actually key. I mean, there's no place for lone wolves or single leaders. So we felt the need to do something together, and this need was based on.
Nawet bym powiedział mojej
it was an obsession, I may say, of my predecessor Anna Dmoszyńska. I mean, to share anything that we could. We didn't have much ourselves. It was difficult times before Poland acceded to the European Union, but we aspired to join the EU. So the first thing was to bind, some personal contacts. We invited our colleagues from Lviv to scholarships. I remember the first the first lessons of the flow cytometer, the operation, then the transfer of our old equipment to Lviv hospitals, and we continued our cooperation for years before the outbreak of the world. This is a seizure between the past and today. We met at a conference, a beautiful conference in Lviv. Before the Transplantation Center was established, and so we showed our colleagues, the ways of operation of such a center. The role models of the physicians, from the preparation for stem cell treatment, through nurses, through cleaning personnel, and so on. 3 days of a beautiful conference, still remembered by all of us.
No i później oczywiście
later on,
i wymiana
continuous the contact and exchange of experiences and solutions, perhaps. Based on our diagnostic capabilities in very difficult medical decision making, based on the phenotypical assessment, genotype assessment, based on blood samples, on bodily fluid samples, and so on. So these contacts actually improved our professional skills and translated in some research efforts that we have maintained for more than 20 years now. So apart from
które mają miejsce, tak naprawdę
some formal cooperation, we are open to joint support to our patients. So on the 25th of February, we got a first patient in our clinic from Ukraine. I don't want to give you specific figures, but they were very high, different patients from different groups. This morning I spoke with my colleague from Katowice. The hematology clinic is undergoing an audit just now, just to permit the future medical treatment in this area over the coming 5 years. So I hope this audit will be completed very soon, and we'll get the opportunity to perform bone marrow transplantations from unrelated donors. So far, we only used family member donors, and based on the official registers, central registers maintained at the Ministry of Health. And as the professor said, it's really key that we actually talk and discuss the ways to actually identify patient groups or the population groups in Ukraine in terms of the potential donorship of hematopoietic cells. We have a lot of problems in that. We have the gene, HLA, the antigen confirmation for genetic kinship or affiliation in our registers, and the registers show that we share a lot of the features among our nations. So within a week there will be a 50th anniversary of Hematology clinic in Lublin. It will be the best opportunity for us to thank all our collaborators and our friends. And this anniversary, this jubilee, will involve the KMS Foundation. That is the largest organization dealing with registering and bone marrow donors, and I'll be encouraging them to extend their operations onto Lviv, to open up a branch office in Lviv. But perhaps it's the only area of cooperation, as I have talked with you. Also, Katerina Nikitschuk, that's from local government administration, and as Maslyak, as Professor Maslyak mentioned, despite the war, the ambitions of our Ukrainian friends, go into the future are quite high. So it's not only about register, but a number of projects that your Ukrainian partners are wishing to implement and would like to implement on the international level in collaboration with Poland, but also with our partners from around the globe. So this is something we expect, we are counting on. Yes, I think that this discipline in medicine is growing, very rapidly now, and stem cells, hematopoietic cells, naturally growing these, and processing the genetic information, to find ways to kill the tumors, kill bacterial enemies, and so on, by specific antibodies. Targeted therapies. This is, a field of cooperation where, which is prospective. It's not only about, setting up, the research centers, abroad, but also joint projects supported from EU funds, in our bilateral cooperation. Not only in hematology, but as the European Commission says, the cancer the diseases, by 2040, 35% of European population is at risk of cancer disease. So this is really needed. But as we live in the times of war, and we should talk not only about oncology, hematology. There is a very intensive cooperation between Ukrainian and Polish centers in terms of ophthalmology. And Professor Preys is a specialist there. Natalia, you were, the starting point actually for cooperation with the Lublin Center. Why Lublin? And what the situation, the collaboration looked like?
Słyszy mnie tam? Dobrze?
Tak,
Can you hear us?
No, współpraca zaczęła się
This cooperation started when
za
the
telefonem
war
w Lublinie, bo ja
caused the people to flee to the Lublin. I'm a student of Professor Radosław. I know him back from Switzerland.
z nim rozmawiałam i powiedziałam
And Professor Tomasz,
profesorem Rajdakiem, że
I spoke to, also knew the professor. So that's how networking started, between physicians from Ukraine and
u nas jest szpital.
and Poland. I work in a regional hospital in Lviv, and we.
Nie robimy takie zabiegi na dzieciakach i
It's children. It's not a hospital for children, so we had lots of children patients or underage patients. We couldn't handle that inflow of patients. And Lublin had the capacity to receive them. Had the tools and resources to perform the complex medical procedures, surgical operations, and so on. So I would like to thank my Polish colleagues for all this.
które są w Lwowie i my teraz
We had a whole network now of partner hospitals in Lviv, in Lublin, and across Poland, with very good collaboration, and I hope this will continue to help both civilians and military members in Ukraine for a long time.
tak było.
Professor Tomek, perhaps you would like to add something to that.
światowy, bo
Yes, why do we have visits from media
z całego świata tak naprawdę, którzy
all over the world,
mówili na klinice
posting news from the ophthalmology clinic? Why this clinic is seen as kind of the expert center, globally?
Chciałbym podziękować
International cooperation. First of all, let me thank you for inviting me.
zagraniczne.
International cooperation for ophthalmology in Lublin, dates back to early 90s, 20th century.
Współpraca z ośrodkami niemieckimi.
We first collaborated with German centers, then Professor Radosław
Tą działalność
extended the operations of our clinic into the European advanced ophthalmology training center from Lugano, Switzerland, and it was there where Professor Reid actually met Nataliya. So now we are second most renowned training center for ophthalmology after Shanghai, and we actually are dealing with the selection, diagnostics, and therapy of
także ta współpraca
genetic diseases.
już ustatkowana od dawna.
So this international cooperation has been long established and asked for technical or diagnostic capabilities. We are a reference center for a large region. Really. We've got technical capabilities and skills for treatment of complicated ophthalmological diseases and conditions that take the technology to treat all parts of the eyeball, different parts. So the Lublin Center was a kind of natural partner, not only because of geography, but also because of the experience in international projects and in the treatment of complicated conditions or even traumas. gathering patients not only from across eastern Poland, but nationwide, and also from Ukraine. Recently, we've got a bank of the eyeball tissues, which make us able to perform mainly corneal transplantation. So at some day we simply picked up a phone, with asking for support, and that's how we started our cooperation, and asked for the development of the ophthalmology and options for international cooperation. Diagnostics in ophthalmology is based largely on imaging, and telemedicine is of key importance, as Mr. Professor mentioned. So, being able to transmit the images to reference centers for diagnosis, for medical decision making, and so on. So we provided high quality cameras to the Ukrainian centers for diagnostic documentation and transfer of images, and we provide consultative services to that. So telemedicine, branch will grow, and for this we have worked with Professor Mark Zerbin from the United States. We had a pilot project completed in Lubelskie, and the next step in this program for kind of unlimited diagnostic support will be the deployment of the AI solutions, where diagnostics can be performed without any human interference, and it is the AI algorithms to diagnose the patients. As mentioned before,
medycyny w ostatnich latach.
The growth of medical sciences over recent years, ophthalmology experiences, enjoys this growth very much, based on genetics and statistics as well. But mind you, the surgical treatment is a key part of this field of the medical sciences. So high quality equipment is key, with 3D the imaging, with images taken to be transferred also to medical centers abroad, to watch these surgical operations and so on. Yes, it's true. So do Lublin-based hospitals use such high technologies, not only in ophthalmology? Let me ask Mrs. the Director. Professor Zubilewicz was planning to join us from angiology and vascular surgery department. Well, he simply couldn't be here, but we know that this field of medicine uses high technologies. I know it from the press or from the news. They use virtual reality or extended reality. And Professor Zubilewicz has taken part in a surgery that was actually carried out in Bulgaria, and he was consulting the surgical team on the in real time. So we mentioned ophthalmology, hematology, and so on. Any other fields of or specialties that you can see international cooperation in? Hello and welcome. It's a pleasure to be here. In my hospital, apart from ophthalmology, hematology, vascular, surgery, gynecology and oncological gynecology is actually key. These are also very important given the sheer numbers of Ukrainian refugees in Lublin. And we are a hospital that that boasts a large share of the oncology departments, both surgery, and gynecology. These are the fields that or departments that actually provide a lot of services to patients.
Dyrektor obserwuje, czy myśli pani, że ten rozwój...
And what your area do you think the technological development to support the online the consultation or online contact, what will be the key areas for you, in your opinion?
Okulistyka już...
I believe ophthalmology has already started.
Widać, że zarówno granty, które mali...
The grants awarded to the personnel of the Medical University from the Ministry of Education and Science, they certainly help telemedicine to develop and also facilitate online consultation. I think ultimately all fields that deal with imaging, so diagnosis that can be shared online,
mogą być przedmiotem konsultacji.
this can be subject to specialist consultation.
Jeżeli mówimy o nowych technologiach,
Speaking about new technologies, and we all work
pani dyrektor jest członkiem
in the Lublin medical cluster.
Rady Klastra.
We have members of the board. We have 170 entities
rozmów właśnie i dyskusji.
clustered together.
Nie tylko właśnie o nowoczesnych terapiach, nowych terapiach.
So it's not only new therapies, modern therapies based on stem cells, but also we talk about digitalization, digital technology, which has become a priority.
Informatycznym.
So there is also this interface with the IT industry.
Porozumiane innowacje również was.
And we should not ignore the overall innovation in IT for this reason. And we sometimes say the greatest medium of innovation might be public hospitals, which is not an obvious conclusion.
I sieci europejskie właśnie mówią o tym, że
the European Commission and European networks, medical networks, say innovations should grow in hospitals. We haven't spoken that much about this, but I'm particularly grateful to Professor Dr. Starownik, Dr. Gawelska, that despite their daily responsibilities, they are the right people to work on innovation in medicine, and they find time to devote themselves to this work. We are still perhaps falling behind our Western partners in terms of taking such innovative processes full time, but of course we already do it.
Świecie wdrożyła w marcu tego roku program takiej akceleracji, czyli wsparcia dla
Mayo Clinic, one of the leading facilities in the world in terms of innovation, has launched an innovation project this year, particularly for startups, also inviting some experts from Poland. And so what about working with Ukraine? Is there any chance to include Ukraine in this process? Well, thank you very much for having me on this panel. Cooperation with Ukraine and relationship building
szpitalami polskimi, ukraińskimi
between Polish and Ukrainian hospitals
Powiedział, że wcześniej nie bardzo było o czym mówić. Dzisiaj weszliśmy dość...
Previously, we had relatively little to talk about. Today, things have changed. Before we even realized, we are now very, very much attached
Wcześniej może dość...
to shared projects, and the cooperation that previously was relatively slow now has accelerated
Szczególnie w czasie wojny, tak? Bo
Dokładnie,
obydwa szpitale
dokładnie.
bardzo mocno
because of the war, right? Because the two hospitals worked really hard on assisting people.
Jest taka zupełnie dla nas prawdziwa i
So this is a real, authentic help.
dużo go o niej opowiadać i myślę, że być może jeszcze będzie na to czas. Natomiast to jest nasza taka działalność codzienna, która...
This is our daily work that, whether this is the number of
nad tymi
patients accepted to specific clinics, this is something that we deal with daily. But you spoke about also assistance in different fields. Well, we should forget this is never a one-sided benefit, that one-sided gets the added value. It always works both ways, and it's a challenge also for both sides. But challenges means there is opportunity.
kliniczna jako
As clinical hospitals, public hospitals, we are very open
mogę powiedzieć za wszystko
to,
szczególnie
I can speak for everyone, but
takich
and across many fields.
przestrzeni do bezpośredniej współpracy i relacji.
So we're very open to establish relationships and cooperation.
Jest do dyspozycji
Our public hospitals are open to innovation, to new ideas, new concepts, and these concepts,
dla nas mogą być
on the one hand,
dość egzotyczne na pierwszy
can sometimes look
raz bardzo przydatne.
exotic, so to say, on the face of it, but may prove very, very useful on the daily basis. We are open,
I chcielibyśmy
and we would like to
wspierać się, tak?
support each other
Też,
through the cluster,
też takie czysto wsparcie
and not necessarily
informatyczne,
on the medical plane only, but in IT, in management.
zapominać i
This is something we should not ignore.
mówić. Natomiast jeżeli chodzi o tą współpracę taką bezpośrednią, o tą stronę, o tą część medyczną, tutaj Państwo
Speaking of the medical aspect, you have spoken about
nasz szpital współpracował
hospital-to-hospital cooperation. Before the war, we had worked relatively long with a hospital from Rivne. After the war, the cooperation has changed its face.
I udało się też przekazać sporą część sprzętu.
We were able to support them with medical equipment. I hope this equipment is still there, serving the local community.
W czasie takim
And
współpraca międzynarodowa, tak?
well, so this was international cooperation, right? Because to ready the shipments of equipment, your personnel, the management of the clinics used their own contacts with medical associations, with entities, also abroad, to facilitate
Przekazywane wyposażenie.
assistance from different places. Even the whole operating theaters were provided. Of course, that
mocy i sugestii
those shipments were made possible. The cluster suggested some foreign partners, including one American foundation. We were able to deliver a mobile operating equipment, new equipment to Ukraine, really high-class devices. And in the international context, we established cooperation with Hadassah Center from Jerusalem, and through that cooperation, we were able to meet in Rzeszów. Our doctors and nurses, they went there to help on the spot, to help at the border crossings in Podkarpackie. That was an interesting and also very intense period of cooperation
granicznej, tak? Bo to
on the very first
W dużej
front line.
mierze to działo się tak bardzo, bardzo spontanicznie.
Yes, and that was often very spontaneous. And
Bo i
now we tend to think about the new stage, about recovering, rebuilding Ukraine. We're thinking about the war coming to an end, that we will be able to return to our regular work.
naszymi ambicjami.
And I believe the ambitions are greater than before. And we often discuss it within our cluster that
Odbywa się na poziomie
previously the cooperation was between the clinics,
profesorów, prawda? To są
between individual professors,
i pań tutaj z Ukrainy,
thanks to individual contacts.
dr Preys i pani
So, and Dr.
i ludziom na
Preys,
klinik.
Maslyak can confirm it. It was people to people, clinic to clinic cooperation. But what about the future?
Ma charakteru
This cooperation is very rarely formalized. It's rather spontaneous, ad hoc. What about the future? Should we
formalizowane.
revise this model? Should we go formal? If not, then what do you think is the concept
Może uczynić
of management at the clinic level to make this cooperation more effective?
tak, słuchając historii
Well, but when listening to your stories of cooperation,
szpitala
we
klinicznego,
have the example of Clinical Hospital number 1.
mój pomysł na to jest
My idea is the following. Don't disturb,
tak, ale mało przeszkadza.
of course, support,
Wszelka
but don't disturb, don't interfere. Any formal agreements that the partners start concluding with other medical centers are fine only when we pursue certain specific projects, when we organize training sessions for physicians, for surgeons, like endoscopic training that we started back during the pandemic together with the hospital in Lutsk in Ukraine. But we had to stop before because of the pandemic. Then, of course, we have an agreement in place where certain rights and obligations should be set out. But besides, as managements, we support initiatives and contacts between nations, but less formally. Yeah, but we spoke about a certain communication platform that might be useful in establishing and maintaining contacts on the daily basis, to involve more personnel in such contacts, to speak more often and about broader subjects, just to see how more effectively we might be able to untap the resources on both sides. As I do remember the visit of the Minister of Health of Ukraine in June this year. He visited our investment, our project, investment project. We are now building a part or extending our hospital. This is a 300 million zlotys worth of construction project. So we spoke about the system of financial settlements, and we saw that indeed there is a need for a platform to exchange experience, to enable the other party to have a closer look at how we are organized, and of course to exchange different ideas on, for example, rebuilding or recovering healthcare systems. So we're talking about not only doctor to doctor or clinic to clinic contacts, but about a general exchange on management and administration best practices. Yes, well, this contact, this communication is absolutely fundamental.
Dr. Nataliya Preys też.
Well, Dr. Preys, a question to you, because Professor Maslyak gave us a very detailed picture of what the expectations are about the future cooperation.
Jest
But you, Doctor,
w Stanach, prawda? Mówiliśmy,
you're in Chicago now,
mają
practicing at Mayo Hospital, perhaps the best hospital in the world, and the US market
chciałby
is where
swoje
a
rozwiązania.
lot of innovations appear, and many people go there to certify their own solutions and test them on the market, because that market is the most technologically advanced, also in terms of new therapies.
Stan,
And you are now,
jeśli pani
Natalia, you're now in Chicago, so tell us
jest
about your perspective
tutaj,
on what is going on here and how ophthalmology works in the global dimension, because you are there not accidentally, I suppose. Yes, I was
Jestem,
invited.
ale ja im, amerykańskim kolegom, z którymi się spotkała, to ja im opowiedziała o naszej
I was invited by the American Ophthalmology Academy. I was talking to local experts about our cooperation with Professor Rejdak, with the eye clinic in Lublin, about trainings I completed here, about
operuje i
Dr. Chorągiewicz, whose operations I watched. So
medycyna, ona
in
inna.
America, they have a different approach generally to medicine, a different approach than in Europe, but they were really glad to hear about our cooperation, about Polish help
Oni
for Ukraine. They are also interested in helping.
with Ukraine,
They keep repeating, we stand with Ukraine.
która była
And the conference
tam
in Chicago,
bardzo
there were interesting lectures,
takie głębokie, bardzo naukowe i
very profound, very scientific content,
tak mam nadzieję, że
and
trwa, że ona
looking at our cooperation with Lublin, I believe this will continue, this will be mutually beneficial.
poziom
And when we work at a global level, at first-class level, we will be able to produce magnificent results.
pomoc
So everyone, underlines, the cooperation and support that Poland gives to Ukraine. But we are looking out to the future. We are thinking about international projects, scientific projects to be operated in cooperation between Poland and Ukraine, involving international partners. So, Professor Maslyak, Professor Hus, from your perspective, if you were to invite anyone to cooperate in the field of hematology, oncology, develop your projects for new therapies and so on.
partnerzy są w środowisku międzynarodowym. Państwo
The closest partners to you, perhaps now.
No ja myślę, że jeszcze takim polem
So I think that the field that we hasn't mentioned
utworów bardzo
is the rare diseases or rare cancers,
dzieci, te lubelskie
child oncology,
centrum leczenia
so ultra rare diseases in children for hematology could be extended. That's what I'm thinking about. For several years now, we have been networking the centers on the interdisciplinary the basis for the mastocytosis.
jeszcze specjalności gastroenterologów.
Gastroenterology, the oncologists, hematologists, a number of specialties involved. So until quite recently, there was quite unrecognized, uncharted territory. Now we are capable of treating this quite well. So this is one of the examples of of the areas for future cooperation between Poland, Ukraine, and international partners. There are plenty more like this one. Professor Maslyak, would you agree with Mr. Professor?
Zwyczajnie. Tak. I jeszcze tak myślałam,
But of course, what I
Utrzymujemy takie kontakty,
What I would add,
są takie kontakty,
we maintain
gdzie,
contacts with
gdzie kształcili się nasze na stażach
with centers that hosted our physicians, that scholarships,
Chcielibyśmy omawiać jeszcze,
and I think that we could also
mamy kontakty z Hamerskim.
discuss, for instance, with Adam Smith Center based in London. They operate
Pomoc chorym
projects
z przylepu białaszku szpikową.
for the chronic bone marrow leukemia,
Z białaszką szpikową.
and you know, the common opinion is that you know, the issue of the disease, you know, has been resolved. I mean, you know, there are inhibitors or inhibitory drugs, you know, that provide you know, long-term remission, the clinical remission as well, not only genetic, molecular remission. But you know, a lot of centers or physicians simply don't know what to do about, you know, patients with a remission. So you know, this is the program that would focus on such patients, you know, for the patients receiving the kinase inhibitor or drug, you know, the health condition monitoring procedures, you know, ways of control and management and follow-up. So this is the area I would like. I would be glad to see future cooperation in, and perhaps we could, you know, take some guidance or experience or advantage simply from the Italian centers of leukemia for leukemia treatment. So this is something that we'll need to discuss with Professor Hus. That is the prospects for for the register, well, diagnosis, identification, and register of donors from Ukraine. This is a project that, well, I understand it. You know, it has been kept aside for a while, but we need to push this forward definitely. Now the war has kind of put it on hold for a time, but it's really important that other Western European countries or Western countries in general get involved in this project as well. The, you know, research centers, the hospitals, both from Western Europe and the USA. Mind you that in the US there is a large Ukrainian diaspora, so they should be interested in doing so as well. Okay, for us to be, you know, aware on who we work with is very important because you know, the European Commission focuses best for the networks of institutions. It shouldn't be just one or two centers. There is multi-center projects that are prioritized in funding. That's why, you know, the identification of potential partners is key, I would say. So, Mr. Director, let me turn back in the context of cooperation with Ukraine, but also in the context of new technologies. Something that we haven't touched on yet today, but something that is, you know, the specialty of your hospital, cardiology and cardiosurgery. Yes, these are, you know, very good examples of the areas of interest. So it's quite obvious, I would say, that modern technology, advanced technology, makes it possible for us to cooperate in a number of fields. So telemedicine, pure telemedicine, when we can transmit the images, diagnostic images, you know, perform the treatments, you know, with proper bandwidth and so on. This is also about consultation of the patient's condition. That is, you know, a discussion, in a team to make the proper medical decision. Cardiology it's an area that perhaps has a future, is a prospective one. What we can observe today, while identifying needs for cooperation, then on top of gynecology and perinatology, which are of specific importance for the refugees. Then this orthopedy, the trauma the departments, and hematology. So this is the area for
kardiochirurgii czy neurochirurgii. To są obszary.
Neurosurgery, cardiosurgery. These are the areas that we should be focusing on. This is again our specialty. So our specialties do not overlap; they complement each other. So all the other areas that we haven't talked about yet, there can be a space for mutual effort, for joint effort, both in the short term and in the long term perspective. Well, it's true.
Proszę państwa,
I would also say that regardless of that, and in view of the proper management of the specialties, let me just underline once again. Hospital management in the context of limited resources, and everyone knows about that. Everyone speaks about that. According to experts, by 2030, we'll be short 3 million medical healthcare professionals in our locations. So perhaps at the managerial level, for hospitals, for medical institutions and so on, how to cope with these challenges, given the limited resources. And resources are limited not only in terms of human the resources or workforce, but also the costs of treatment of our patients. So this is perhaps also the area where we can talk about new technologies. Ukraine boasts very high IT and digital competencies. Mr. Director, I know that you have tested some solutions from Ukrainian businesses. A lot of applications now emerge and enter the market, if only for energy efficiency, but also for the diagnostics that could help cut the costs. So would you be open to such cooperation with Ukraine? Would you be open to testing and deploying such solutions, in the area of this type of innovation? There are plenty of aspects that you have mentioned, but briefly speaking, yes, definitely. Any area of cooperation can be taken advantage of, can be tapped into, and the matter of costs of today's medicine, whether it is oncology, hematology, which are classical, the flagship examples of personalized medicine or targeted medicine. That is, in the sense that we, prepare, tailored therapies, based on personalized diagnostics and so on. Immunology, genetic testing are key. This testing is costly, but we should not forget about the practical medicine, that is surgery, robotics that can be used in this area. Purely technical solutions, like medical equipment. There's a lot of progress, a dynamic one, that we can see, that we can tap into. You mentioned human resources. In fact, it is a huge challenge.
że kwestia braku
It seems that the shortage of healthcare professionals perhaps could be solved by the growing numbers of medical departments at universities across Poland.
w naszym kraju. Natomiast
And
jako
not only in Poland, but as a clinical hospital, I can say this:
mamy
we
jeszcze
do not struggle. We
problem.
have not experienced the limited human resources as other hospitals have. But perhaps we feel the pressure.
Co ssanie, przepraszam za określenie, ze strony
It's not the push, it's the pull from other hospitals for our doctors.
walczyć
So this is a competitive market. We need to be active to kind of retain our the personnel and
Ale musimy myśleć o przyszłości.
our human resources are quite extensive, and then we need to think about the future in this time. The future
interesująca jest
seems to be quite interesting, let me put it this way, as far as
podstawowym zadaniem przynajmniej, jeśli chodzi o
workforce or personnel is concerned. So our basic task is the retention of healthcare professional that
dużą potrzebę rynku.
base, which seem sufficient for the time being, but we are starting to see that the situation is changing.
Patrz,
In a broader perspective, broader than just a single hospital
kadrowych,
and human resources needs. Let me say this: the pandemic time has opened our eyes and gave us, another look
prawda,
in a number of aspects. Suddenly, it appeared that we can
realizujemy
complete a lot of tasks online.
tych ograniczonych
So with the limited human resources,
sposób spojrzeć.
we need to be looking in this direction so that the National Health Fund, that is the public payer,
Cenia telefoniczne w tej chwili
simply couldn't
teleporada jako standard.
imagine they would pay for public consultation.
Spojrzeć
Now this service is being, is contracted in our contracts for funding. So we need to redefine our plans, cost plans as well, given the limited human resources, limited pool of healthcare professionals. Beds in hospitals. We need to sacrifice part of the beds pool to actually ensure full protection of sensitive patient populations.
musimy się przygotować.
So we need to be prepared for, another pandemic, for instance. So hospital beds cost a lot. So we need to separate, some pools for generally
Jednodniową.
for single day or ad hoc hospital care, while limiting the bed pool for general health
Jest niezwykle.
care or health service.
Przede wszystkim
I'd like to thank you very much for your valuable inputs.
lekarzom, profesorom i osobom zarządzającym. To wszystko, co Państwo
Participants from Poland and Ukraine, whether you are physicians, professors, or managers, thank you for your effort in protecting human lives, in caring for the patients, for your involvement in those difficult times, and for the solidarity
międzylekarską
in terms of healthcare. For individual hospitals, individual doctors, and individual institutions. And let's look into the future so that we are in a position to be to design the wisest possible, the best possible solutions for the future, given the trends that we have today, so as to win a better future for both the patients and ourselves, so that this future, the use of resources is wiser and wiser, and the use of our competence and our powers is as effective as possible. Thank you once again for your attention. And let me just announce
poświęcony dezinformacji.
another panel discussion on disinformation and manipulation organized in cooperation with the Institute of Central Europe based in Lublin. Thank you very much and see you at the next panel.